All right, so let's talk about the adrenal glands. Forgive me, I'm a little technologically slow. I have other good qualities, I promise. Okay, so what are the adrenals? What's the name adrenal mean? Where did that name come from? Well, the original term adrenal fatigue came about in the late 1990s by a naturopathic doctor named James Wilson. And he is the one who kind of figured out this syndrome. It's a collection of related symptoms caused by insufficient adrenal gland function. So basically, the adrenal glands are anatomically okay, but functionally, they're not able to perform their job effectively. And a lot of symptoms can arise out of that. So we're going to talk about a little bit about where they are, what they do, when they're deficient, when they're overactive, those type of things. So anatomically, they are sitting on top of your kidneys. I think of them as little kidneys because they kind of look the same. In Chinese medicine, they consider the kidneys and the adrenal glands one organ. When you are born, next to your heart, your adrenal glands are one of the largest things in your body. And when you die, they look like shriveled up peas. When I was in chiropractic school, we had to do a lot of gross anatomy, and trying to find the adrenal glands on patients was always quite challenging because we trash them. Without our adrenal glands, we would not be alive. So they're extremely important to our health and often a very underlooked gland. The gland is broken up into two main areas. One is called the cortex, and that area produces hormones that we hear about, like cortisol, aldosterone. And this helps regulate our metabolism, our immunity, our stress response. That's what the cortisol does, right? And the aldosterone helps control our blood pressure and has ties to proper cardiovascular function as well. The medulla is the other part of the gland, and this produces hormones that are not vital for life, but definitely essential. It does help with dealing with our physical, emotional, and our emotional stress. It contributes to the fight or flight response of our parasympathetic nervous system. Our parasympathetic nervous system is our rest and digest, that calming part of our nervous system. They also are the highest hormone producing site in your body of sex hormones, next to the ovaries and testes. I do think this is important to note because in our practice, we deal a lot with infertility issues. And one thing that is grossly missed with fertility is looking at the hormone production of the sex hormones. So oftentimes part of infertility has to do with a patient who's extremely stressed out and those sex hormones aren't being made appropriately. So something to think about if that's a challenge that you may be going through. Okay. Symptoms of adrenal fatigue. A lot of these may be non-specific, but when we look at the patient as a whole, they do start to feel a pattern. So the one thing that I always ask my patients are, do you feel rested upon waking? If you slept 8 hours and you do not feel rested upon waking, that's a red flag. Do you have a hard time getting up in the morning? Do you feel like your energy levels throughout the day are inconsistent? Difficulty handling stress? Food cravings, specifically for salt, is something you want to pay attention to. Getting sick often, unexplained body aches and joint pain, depression and anxiety, dark circles under the eyes, low blood pressure, not high blood pressure. It's harder for you maybe to repair after an intense workout, or it takes longer for your body to recover. That would be the patient who wants to hit it hard, feels good at the time of the exercise, but then they're done. Like for the next week or so, they're exhausted from that one workout. Poor circulation and numbness, lightheadedness or dizziness, weight gain, and fluid retention are all some of the symptoms of adrenal fatigue. All right. So stress in a good way. I do think the stress response is important. So it is something that we as human beings absolutely need. We need to have an adequate stress response. So we were really designed that, if a lion is chasing us and we need to get away from that lion, we need those stress hormones, right? We need that cortisol. We need to get out of that situation. The challenge is, in today's society, we are living in the space of a lion chasing us 24/7. That lion is, your job, your relationships, your health, your immune system, everything coming at you 24/7. So the stress response is becoming inadequate. It's not working appropriately because there's no downtime. It's like this constant hamster wheel of perpetual stress. And that's where we get in trouble. That's when we start to see dysfunction. So chronic stress, like I just said, is where we get into trouble. Short bouts of intentional needed stress to get us out of a dangerous situation is pertinent to our survival. But chronic stress is what's really killing us as a society. And you guys listening know, in the days and the times that we're living in, we're all living right now with constant stress. Unless you're under a rock, you're feeling stressors that weren't even there before because of all of the things happening in the world right now. So it is important to acknowledge that you're not alone, and it is something that we need to be cognizant of so that we can manage it a little bit better. When we don't work on resolving our stress issues, we're looking at choosing a poor nutrient diet, not getting good quality sleep. Your best friend becomes, your best friend becomes caffeine, right? You need that caffeine to get you going in the morning or functioning at 2 o'clock in the afternoon. You're in real trouble if you can have a espresso before bed and go to sleep. That's a great signal that your adrenals are not doing well. Overtraining, emotional trauma, these are all things that will create a surge of cortisol, give us an increase in energy, an increase in blood sugar, but start to trash our immune system. It also this long stress starts to contribute to the breakdown of stored protein and carbs. So that's also contributing to what we're seeing with what's called insulin resistance and metabolic resistance too. So it starts to encompass the entire body, right? It's not just localized to one area. You will start to see breakdown in all areas. It's also important to note that there's an inverse relationship between immunity and adrenal function. So what that means in English is the more stress you are under, the weaker your immune system will be. Your body has to make a choice. Is it going to deal with the lion screaming in its face all day, or is it going to deal with your immune system? It's always going to pick the lion because that's the perception of danger, and that's where we need to address that right away, right? So people who are under prolonged chronic stages of stress will be more prone to getting sick and not rebounding as quickly as people who are not under long periods of stress. The adrenal thyroid connection is extremely important to understand, and important when you're starting to feel symptoms that could be adrenal related or thyroid related. They do communicate to each other through different pathways and hormones. The thyroid doesn't operate when the thyroid isn't working well. You're going to start to see adrenal symptoms, right? Which are going to be fatigue, depression, weight gain, muscle aches, brain fog, low libido, those type of things, dry skin, all those things. Unfortunately, it starts to get hard to distinguish, is it an adrenal problem or a thyroid problem? So oftentimes you'll go to your doctor and you'll get your thyroid checked and they'll say you're fine, but maybe you're not fine because there's an adrenal component with a thyroid that's not being addressed. So they do work together. Thyroid dysfunction is its own topic. Honestly, I'm just going to touch on this. Now, I will say as a practitioner, one of the most frustrating things is to talk to a patient and they tell me, yes, Dr. Jen, I got my thyroid checked. And I say, great, let me see your labs. And then I look at their labs and they've only had TSH and T4 checked. If you can take one thing away today, TSH and T4 does not make up all of the things we can check in the thyroid, and you will miss everything all day. So it is important to understand that a full thyroid panel needs to be run, that you cannot adequately diagnose if there's a thyroid problem with 2 values. It's impossible, and you will miss things all day. Another thing to note is that you can have a normally functioning thyroid with a lab test, but have an autoimmune thyroid problem. They're 2 different things. They need to be tested differently, and they cannot be mutually exclusive. So you can have, like I said, a normally functioning thyroid and have an autoimmune thyroid problem like Hashimoto's or Graves' disease. So it is extremely important to get the right things tested. In addition, a value called reverse T3 is important to measure, and we can do that through normal blood testing. And that is measuring how the thyroid is specifically talking to the adrenal glands. So when reverse T3 levels are elevated, we have to think about, okay, that's a red flag that the communication between the thyroid and the adrenals isn't great, and we really need to assess the adrenals of that patient. I'm just going to throw out some of the things that should be tested. And once again, you can always reach out to me through email if you want more information, but things should be checked: TSH, free T3, free T4, reverse T3. I like to run thyroid antibodies as well. Sex hormone binding globulin, leptin. There's a bunch of things that we can check. So anyway, just want you guys to understand there is a relationship between the adrenals and the thyroid, and they both should be evaluated, especially if you are living in the space of chronic fatigue. So functional diagnosis or functional medicine is the space with which I live in. That is listening to my patients, doing testing, and working out or trying to see how we can support you prior to your issue becoming a pathology. So traditional medicine waits for your lab values to be off so then they can give you a medication and say you have XY disease. Functional medicine goes, this patient has all of the symptoms, we'll say, for example, of adrenal dysfunction, but maybe their labs aren't screaming adrenal dysfunction. But we're going to start supporting that immune system. We're going to start supporting the adrenal glands or the thyroid or whatever system it is, so that they don't necessarily go to a pathological state. And that's really, really important. Now, with the adrenals and the thyroid, one of the things you constantly hear is, I'm losing my hair. I hear this constantly. It's thinning out. It's not as thick as it should be. Women experience this often after pregnancy as well. Well, they start noticing hormonal imbalances, as well as men. So, they also can have hormone imbalances. So that's something that we can look at and assess and try to see what the underlying cause of the problem is versus waiting till you have an actual disease. The other thing I want to say about this is it is supremely important what tests you choose and what tests are run. You can check the adrenals through blood work. However, I do not feel that is the most adequate way to address adrenal dysfunction. The best way, honestly, is through saliva. And we like saliva because saliva has cell tissue. Cell tissue is going to give us information about disease processes and hormone levels based on how long they've been in the body. So, for example, we know that around every 120 days, we make new red blood cells. We also know that after time, things leave the blood and deposit deeper into the body, like the tissues or the bone marrow. So blood work can often miss things because the problems start to go deeper into the body. So you cannot just rely on one form of testing, especially if you have a very symptomatic patient, because we can miss something. You can get blood work done and your doctor will say, oh, you're totally fine. And maybe you're not totally fine, and then you also start to question your mental health going, oh my gosh, am I making this up? Most times, absolutely not. It's just the right testing hasn't been done. So I definitely encourage you to do saliva. blood and or urine testing. Don't just go with one testing for the adrenal glands. And there are a lot of tests that we can do through labs for blood work, but we also need to look at the whole patient. All right, let's talk about the 4 stages of adrenal fatigue. The first one is the alarm, then it's resistance, then it's exhaustion, and then it's failure. So we're going to kind of touch on each phase as we go here. Okay, let's see here. The alarm reaction. This is our fight or flight, right? This is our high cortisol levels. We're really under a ton of stress. We're sweating, we're hot, where our heart is racing. That is the body's immediate reaction to stress. Oftentimes our blood pressure can go up as well. You'll notice that your sleep patterns will start to get disturbed. You're going for that coffee more, you're going for that muffin, you're doing all of those things. If you notice that you're choosing foods like that, and you may want to take a step back and go, why? Am I choosing this because I just want to eat it? Or am I subconsciously making these choices to put stimulants in my body to keep me going because I'm so stressed out right now, right? This is often categorized as the stage of being wired but tired. And most of us go through this through many different times in our lives, depending on what's going on. You know, a stressful time at work, a stressful time at home, a stressful time with our health. This isn't a one-time only response. And you'll start to notice when you're living in this alarm stage, you'll also start to notice blood sugar or insulin response patterns start to show as well. The resistance response. This is when your adrenals begin to lose their ability to keep up with the body's demand for cortisol. During this stage, you're really tired. Like you just can't even hold your head up at your desk, right? You just like you dream about going home and taking a nap, or you dream about going home and just getting in bed and going to sleep after work, right? You don't feel good after sleeping. You have insomnia. You notice you're getting more anxious lately. You notice your family or friends are going, you're kind of grumpy. You're becoming really irritable. And this is the time where you go, well, maybe I need to go see a doctor. Maybe there's something actually wrong. I don't feel really good. And you will start to see hormonally when we do testing, drops or in DHEA, which is a big hormone that's involved with youth and reproduction, and you'll start to see a drop in testosterone, which I'm seeing a lot in men right now. Young men, not older men, young men. I have men in their 20s with low testosterone. The first thing I think about is what is the level of immune function and stress in this person. So those are red flags that you should start to think, maybe I should figure out what the cause of my stress is, or maybe I should start figuring out who I need to see for some support around this. Stage 3 is full-blown exhaustion, right? Your glands are less effective. The body wants more adrenal hormones, but the stress levels are still present. So they're scrambling for these hormones to be made, but you're just not giving your body rest and digest time for those hormones to be remade. You're going to see a harder time with exercise. You're not going to be able to do the same things that you used to do in the gym. Longer for recovery, brain fog. Oh, I'm getting a cold again. Oh, I'm getting a cold again. Or I have strep. My kids have strep, so now you start to catch everything, right? Because your immune resistance starts to really drop at the adrenal exhaustion stage. You don't want to be intimate with your partner. You notice you're getting a lot of weight gain around your butt, your stomach, and your thighs. And you're noticing you're just not as productive as you used to be. You're not getting as many tasks done during the day because you just can't focus long enough to do them. Stage 4 is adrenal failure. This one, the adrenals, I say, packed up their suitcases and they said, peace out, I'm done with you. This is severe advancement of adrenal fatigue, and it can actually cause a pathological disease called Addison's disease. Our goal is to get you never to get to that place, but Adrenals left unchecked over time can create a severe problem. And these things would, Addison's disease would look like sudden pain in your low back, legs, and abdomen, digestive distress, vomiting and diarrhea, severe dehydration, low blood pressure, loss of consciousness, higher risk of cardiovascular collapse. And clearly at this point, you need to be under the supervision of a medical physician because this is beyond your scope of trying to manage. So something to think about. We don't ever want to get there. So what can we do? Well, first of all, we need to kind of get to the root cause of what's causing our constant stress response. So if you are in a relationship that is unhealthy and you are not dealing with it, let me be clear. You can take all the vitamins in the world. You can do all of the things. But if you're in a toxic situation, your body will not heal emotionally. If you're in an emotionally toxic situation, your body will not heal appropriately. Taking vitamins is not going to be a miracle solution. You've got to figure out the underlying cause of the stress and manage it. If that's through counseling, if that's through switching a job, if that's through switching a relationship, it's extremely important because the body just perceives the symptoms of stress. And if you don't do anything to take those symptoms away or that situation away that's causing it, you will not heal. Really, really important to understand. So getting to if there's an emotional component, making better dietary choices, staying away from the things that are fast acting that are going to give us a pickup and then give us a crash, right? Like the caffeine and the sugar specifically. When you are under an extreme amount of adrenal stress, I usually tell my patients to refrain from harsh or intense HIIT training exercises because you're creating more of a stress in the body. Exercise in itself is fantastic unless you are dealing with the adrenal compromised patient. Then we would like to encourage you to do more things like walking, some stretching, maybe a yoga or Pilates, but refraining from anything that's high intensity because your body won't have the opportunity to properly recover and you can actually hurt yourself if you're in those stages of adrenal distress. Getting yourself on a regular sleep schedule is really important. Staying up till 2 a.m., don't recommend it. It's not good for you. In Chinese medicine, every few hours represent a different organ system repairing. If you're staying up past, 11 o'clock, certain organs that need to repair aren't going to get the time to do that. So, which then means your adrenal glands aren't going to get the time to get their repair time. It absolutely matters the time you go to bed. I have patients that will tell me, well, I got 8 hours of sleep. I'm like, in what window did you get those 8 hours of sleep, right? So the window does matter. I know my nurses, ER doctors, shift workers usually have the worst adrenal glands because they don't work normal hours. And so their body's so not in sync that it can cause adrenal dysfunction. So it's really important to sleep at the right time of day. Hydration. I say this all the time. Water is not just for washing people. You need to drink it. Ideally, you would like to consume half of your body weight in ounces. So if you weigh 100 pounds, then drink about 50 ounces of water a day. If you like coffee or caffeine, it's depleting of water. So add that in. If you have, an 8-ounce cup of coffee, then increase your water consumption an additional 8 ounces to make up for the lack of hydration that those caffeinated beverages take away. Do things to heal the body, prayer, meditation, quiet time, whatever that is for you. Start thinking of ways to put that in your daily life, not once a week, not once a month, not when you take a vacation. That's not how it works. Just like you would schedule a meeting for yourself or for a client, you can figure out 10, 15 minutes a day at minimum to kind of recenter and check in with yourself if you don't have time. If you don't have more time than that, right? That's why God made locks on bathroom doors to hide from our children, to have quiet time. Okay. For the adrenal diet, these are just general guidelines. Clearly, every patient's an individual and nobody's exactly the same, but these are some just really great overview suggestions. Staying away from the processed grains, the vegetable oils, sugar, fast food, all of those things are going to be really, really important to avoid. They're going to be actually very harmful for your adrenals. What we want to do is eat more healthy fats. I know you guys are sick of hearing this, but it's true. Healthy fats are just coconut oil, avocados, olives, olive oils, nuts, seeds, grass-fed butter, fatty fish, vegetables. Fermented foods give you great probiotics. Protein specifically in the morning. Eating adequate amounts of protein are going to help keep your insulin and glycemic levels more stable, so you won't have these fluctuations in sugar, which will stress out your adrenal glands. So it does matter, how you start your day off with what kinds of foods. Once again, everyone's an individual. It is recommended to consume, if you can, about 40 grams of protein in the morning. If that's too much for you, then do less. If you don't want to eat eggs and the traditional, breakfast, then don't. If you want to do a protein shake, that's a good quality protein shake that's nutrient dense, you can do that. But just realize how you feed your body is going to set the tone for the rest of your day. And what you put in it is going to set the tone for how your adrenals respond to stress. So the occasional cheat's fine. But if you're waking up with, your bagel and coffee, you need to really rethink what you're starting your day off with. Blood sugar. Number one thing killing us right now is all of the ramifications of an increased sugary diet. Once again, it increases the level of cortisol in our body. Our body reacts by dumping a bunch of insulin into the bloodstream. The insulin makes our cells take in much more sugar to try to maintain those blood glucose levels. And, if our diets continue to get more sugar in than we actually need to use, that's called weight gain, right? So those are things that we can control. These are things that we can change. It'll give you weight gain, inflammation, and you'll start to get health complications. So maintaining adrenal stable blood sugar is going to affect your adrenal glands. So we've learned that your thyroid communicates with your adrenal glands, and we're learning that your blood sugar has an effect on your adrenal glands. So I hope you guys are getting a picture of how everything is really interrelated, and that you can't pick and choose, that all of how you live your life, what you put in your body is going to have a systemic effect. And these are the things that kind of start communicating to each other and start breaking down all at once. And then it can get overwhelming to treat, right? Because you don't know, am I treating a blood sugar problem, an adrenal problem, a thyroid problem? And at that point, my answer to is yeah, we're treating all of them at this point. So if we can step back and start going to the root cause of the stress, then we can start actually making lifestyle fundamental changes that are going to be lasting. Vitamins are super necessary for our natural processes. Minerals are important for our hormone production. So some of the things you might want to think about adding, some natural salt, like a little bit of sea salt to your water, is great to help the adrenals recover. Now I say a pinch of sea salt, okay? I'm not telling you to drink, a ton of salt water. I'm not telling you to drink water that tastes like salt. Just a pinch in a water bottle will help with your adrenal glands. It helps specifically with the aldosterone hormone, and that's responsible for salt regulation. And that hormone can get affected when we're under adrenal fatigue. Vitamin C, everybody knows vitamin C is like the most powerful antioxidant, but it also helps the adrenal glands recover. Same with vitamin B. B5, B6, B12 are specifically involved in cell metabolism, and they also help with fatigue reduction. Vitamin D, we're also chronically deficient, especially living out here on the East Coast. We're very far from the equator. We're not getting usable vitamin D. Fortified foods are not the way to get vitamin D. So taking a D supplement is really going to be important. It increases when you've got adrenal fatigue. It's going to eat those vitamin D. It's going to eat up your vitamin D much faster. So one way to help your adrenals is to get on a good D supplement. Magnesium, it also helps with adrenal fatigue. Probiotics, right? We know that probiotics improve our digestion, our immunity, our absorption of foods, and our hormone production. Once again, you would need to kind of sit with your doctor, figure out what stage you were in, what you needed in that stage, and what you could do to maintain health. Adrenal fatigue and sleep dysfunction are basically related. Adrenaline and cortisol both increase alertness, and they will affect your sleep patterns. You may have a problem falling asleep, staying asleep, or both, right? It depends on what's going on and how we can support that. There's nutrients we can give you to get to sleep, and there's some strategies around how to stay to sleep when you've got adrenal dysfunction. Some tips are just creating a schedule for yourself, you know, with when you go to bed and when you wake up. Resting when you feel tired. I always tell patients, if you are tired and you have a choice between taking a nap and working out, go take a nap. It's going to be more restorative, and you're going to feel better, and then you can exercise later if you still feel so inclined. But a person who has adrenal fatigue needs to listen to their cues that their body is giving them, so they can actually get some repair time. You want to sleep, you know, about 8 to 10 hours a day, and don't stay up crazy late. Stress management, that is going to be something that is extremely unique to you and your situation. I do recommend that if you are living in a space of extreme overwhelmness, don't close your mind off to therapy. Counseling can be fantastic. It can be a game changer. Just learning strategies, you guys. You don't have to sit there and share your deepest, darkest secrets, but it is nice to have some tools to deal with stressful situations as they come up in your life, so that you can make better choices instead of sitting in that space of stress and feeling all those hormones kick up. So if that's something that you need, be open to it. And there's so many options now virtually too. So I'll stay off my soapbox about that, but I am a big proponent of mental health and doing things to support your mental health. Essential oils are fantastic. You know, in Bible times, that's what they would use. Frankincense and myrrh have extremely calming properties, just smelling them. And there are other oils, obviously. There's lavender, there's a ton of other oils, but maybe, you know, diffusing some oils or putting a little bit on your wrist so that you can smell throughout the day will help bring down some of those cortisol levels. Practicing mindfulness and meditation, whatever that means to you. Meditation for some people can be taking a walk. It doesn't have to be what we associate with sitting in a yoga position in a mountain somewhere, calling or being a yogi. It really just means finding that space to check in with yourself and have some quiet time, whatever that looks like. Breathing deeply, you can Google a ton of breathing methods that help regulate your heart rate, your adrenal glands, things to just calm your body down. Just taking a few minutes every day can be really helpful. Choose to create a life where you have people that you care about in your life. We have learned that life is crazy and it is very short. Do not waste your time with people or situations that aren't going to keep you healthy. Writing how you feel, getting some of those stressful emotions out is very powerful, because you can put them on a piece of paper and it helps leave the body, which downplays those crazy hormone levels. Listen to music, take a walk with a friend, drink some tea, get a massage, whatever it is for you, figure it out. Put it in your schedule. Start doing it now, because these are the things that are really going to help you. And that's kind of where I'm going to leave it. You know, stress management in the times that we're living in are not negotiable anymore. It is not a luxury. It is a must. You've got to figure out how to manage that. And working with a practitioner like me who looks at the whole body, who can support you nutritionally, and kind of take take the time to do the testing. That would be my other big piece of advice. Don't just assume that it's going to correct itself without some work on your part. Thank you for your time. I appreciate you being here. I appreciate the fact that you spent a little bit of time with me to learn about something maybe you wanted more information about. I am readily available to answer any questions if you have about the presentation or any other health questions that you have. I am best reached by email. I do have limited office hours, so I'm not always physically in the office, but I am reachable by email most of the time. For my nutritional patients, I offer telehealth and virtual medicine consults if that's easier for you as well. So you do have options if you want more information. If you have any questions right now, I would be more than happy to